Okay, again, I would like to welcome everyone to our event tonight. We are here to have our virtual speaker series on mental health, healing from the inside out, a look at postpartum depression. Our sororities are dedicated to promoting health initiatives that are relevant and important to our community. Tonight, we come together to have a discussion about this silent illness that greatly affects mothers, and if it's left untreated, can break families apart. Let's have a conversation about it with our expert panelists in the field of mental health. First, we have Tashika Witter. Tashika is a licensed associate counselor, LAC, with a passion for helping people navigate life's challenges. She is a mental health/family therapist. As a primary therapist at Princeton House Penn Medicine, she provides compassionate care and support to women facing trauma, addictions, and other mental health challenges. Tashika is also a counselor intern at Restoring Pieces, LLC, where she specializes in marriage and family therapy and mental health, helping clients to restore balance and harmony in their relationships and lives. But that's not all. Tashika is a true Renaissance woman who's equally comfortable hosting seminars, facilitating workshops, and speaking on mental health, marriage, and family matters, both locally and internationally. She's even a co-author of a book, Practical Strategies for Effective Youth Guidance, which is a testament to her dedication to helping others thrive. Welcome, Tashika. Next, we have Tamara Pamels Boone. Tamara is a clinical director at the Holistic Behavioral Solutions Counseling Center in Pennington, New Jersey. Tamara has been practicing client-centered solution-focused counseling since 2000 throughout New Jersey system of care, including a decade of experience at Rutgers Hospital as a mental health clinician. Tamara dedicates her life to wellness and service, believing that we already have the tools to be our best selves, and we all just need a little help finding those tools within. Tamara is the author of Living Balance and finds herself swimming or running around with her family when not in the office, helping change happen. She happens to be a member of the Trenton Alumni Chapter of Delta Sigma Theta. Welcome, Tamara. And our final panelist tonight is Andrea Aldridge. She is the daughter of a former board president, Joyce Campbell, of NAMI Mercer. NAMI stands for the National Alliance on Mental Illness. Andrea is passionate about letting other people know her experience after the birth of her son and the help and support she received during this difficult time. We are confident that her sharing will be impactful for tonight's discussion. So now that you've met our panelists, let's start our discussion. Bianca Taylor of Delta Sigma Theta and Donna Williams of Zeta Phi Beta will serve as our moderators. Whoops.
Hello and good evening, everyone. We are going to jump right into the discussion here. We have a few questions for our panelists here tonight, and for Tashika and Tamara. These questions are posed to you both, so if you feel that you want to jump in and answer the question, either one of you are certainly welcome to do so. With the first question being, what is postpartum depression and what causes it?
So you want either one of us to jump in?
Yep.
Okay. Do you want to go ahead? Go ahead.
No, I'm telling you, go ahead. I'll go right behind you.
Okay. No. I defer to you. Go ahead.
All right, thank you. Good evening, everyone. Postpartum depression this is one of the serious mental illnesses that affects the brain, and not just the brain, behavior and physical health of women. As the word suggests, it's postpartum, so it's usually very shortly after pregnancy. This depression, and I know the question is coming up regarding baby blues, usually if this is continuing after about 2 weeks into an extended period, it is depression separate from just those afterbirth feeling of, oh, I'm becoming a mom. Things are going to change for me. So depression looks similar to the symptoms of depression, like not having the motivation, having overwhelming sadness, not wanting to spend time with your baby. It's almost like that mixed with some grief and loss symptoms, because you're grieving the loss of sometimes yourself, what's happening, the new things that are happening to you. So anything from feeling sad, hopelessness, crying, having even thoughts about hurting the baby are some of the symptoms of postpartum depression.
So I agree, absolutely. I think it's also important to realize in terms of numbers, baby blues happens to about 80% of women, whereas postpartum depression is like 10 to 15%. And really the difference is the duration and the intensity. So if you're so 80% of mothers right after birth, you're tired, your body's been through a lot, you're kind of overwhelmed. So your biological needs are really not being met. Your body is sending energy out to the baby, and that's the primary concern. And in the short term, that's not a problem. But over a period of time, that sleep deprivation starts to corrode the inner self. Your body is also detoxing from 40 weeks or 10 months of carrying another being and caring for another being. And so at that point, postpartum, everything comes rushing back, right? I like to look at it like a house of cards. So a baby is an amplifier. If your house had a solid foundation prior to pregnancy, you're going to be able to bounce back a little bit faster. If there are things in your emotional and physical house that are shaky, those things will become seen or known very shortly after. So baby blues might be 6 to 12 weeks as your body recuperates. If after 8 weeks, you're like, I don't even feel attached to this baby, right? And you were kind of looking at people through a pane glass, as if it's something's just, it feels like you're not quite in the world. It is really important that you get help quickly, because postpartum depression can work its way into postpartum psychosis very quickly. And it is something that needs to be addressed medically with an actual provider.
Okay, thank you for that answer, Tamara and Tashia. I think I'm saying her name correctly. Please forgive me if I'm mispronouncing. So, Tamara, you touched upon it. Both of you touched upon the baby blues and the postpartum depression. But Tamara, if you wouldn't mind going into a little bit more detail about that. You said something about the 6 to 12 weeks, but what are some of the ways that you would know what the difference is between the baby blues and the postpartum depression? I mean, other than, like you said, I thought what you said was really good about the house of cards, the foundation being solid and shaky. Would that be something that would be a part of it as well? And I would appreciate responses from both of you. Thank you.
So yes, absolutely. One of the things that you're looking for, or we look for as clinicians, is sleep and appetite disturbance. That's your first giveaway that something is wrong with a person that you care for, right? So if this person is sleeping more, that's hypersomnia, or they're sleeping less, that's a huge problem. If all they want to eat is cookies all the time, and like if there's an appetite disturbance, or sometimes they don't want to eat at all, because when you have anhedonia, which is like loss of pleasure in life, which is a depressive symptom, everything feels flat. right? It's almost like someone turned down the color in your eyes and on your sensations. So food doesn't really taste that great. You go outside, and if you're in a good space, you're like, oh, what a great day. It smells so good. I want to be here. When you're depressed, you're like, all right, okay, what's next? I'm just here. So there's a flatness to it. Other things that you're really looking for, you're also really looking for self-talk. So if you hear a mom start to say things like, yeah, whatever, like very just kind of, if this person has previously been joyful and connected to their family, and all of a sudden they start to isolate, I don't want to see anybody, right? No, can so-and-so come over? No, don't want to see them, right? You know that there's an issue.
Just to add to what you're saying, Tamara, which is amazing, with baby blues, sometimes for baby blues, research showed that it can last up to 10 days, a little longer, right? So if the symptoms that are similar to depression, because it looks like depression, it looks like that sadness, looks like that, oh my gosh, my life is changing, or I have to be watching this baby every second. They always say, oh, sleep when the baby's sleeping. Personally, as a mom, I never really experienced that, at least not with my first child. Because you're told to sleep when the baby's sleeping, but then you're told about SIDS and other things, and you're like, should I sleep? And then especially when you look at your family dynamics, not everyone has that support of having grandmom and other people to come and stay with you for the baby. Sometimes your husbands are going back to work. So there's this, I'm not resting well. So as Tamara mentioned, some of the feelings and the symptoms and the thoughts that are going to come with that will lead to like moments of sadness, your desire towards food because you're constantly breastfeeding and everything, and the baby won't latch. Like just the reality of some of the natural processes that take place when you become a new mom that you weren't doing before, throws you into this feeling of, oh my gosh, this is exhausting. And if you're not resting, like it really puts you in a bad space emotionally, mentally, because sleep deprivation can look like many things, right? So with the baby blues, you will experience that for a few days, as we said, but once that continues and persists beyond and into weeks, then we're looking at postpartum depression, which I shared some symptoms earlier. Baby blues, as Tamara pointed out, the 80%, it tends to be more natural and normal because of that change that you go into. And some people may not experience it with their first child. And, they're so excited it doesn't happen. But other people may share that when I had my second child and third child, and it just gets like that for me after delivery.
Something else I want to point out also, if you find mood lability, so that's a person that is kind of like, they're fine 1 minute, and then all of a sudden they're like, everything makes them cry. If they have like lots of tearfulness, like if they're watching commercials and, like those things are very touching and they start crying very easily, that's something to investigate as well. Something that I forgot to mention earlier is family history. So more than likely, if you have a family member that has experienced postpartum depression, you want to be very aware of this because you will most likely experience it as well. Also, there is a scale when you go to your provider, there's a lot. When you go to your provider, there is a scale that they give you. There's an actual test that they give you. And by your answer to that test, they should be able to get a good sense of, is this baby blues or is this postpartum?
Yeah, Tamara, just to add, like the predisposition, from genetics, your family member. Also, if you were suffering depression or had a diagnosis of, major depressive disorder, etc., prior to pregnancy, then more likely you will experience postpartum depression, after.
All right. And this question I posed to the both of you. I guess Tamara, you can take this one first. Are there other prenatal moods and anxiety disorders? And if they are, what are they?
So when you're looking for kind of perinatal mental health issues, it's the same thing that you would see just in a regular, typical person. So, and that would include anxiety. And anxiety is the #1 most diagnosed mental health issue in our country, and I would assume in the world as well, because there's a lot going on, and we really kind of can't catch a hold of it sometimes. So anxiety is probably going to be your #1. Something else to be very aware of is bipolar disorder. So you might start to see irritability, rage, like maybe a mom who is pregnant or, and she gets irritated very easily, right? We're just going to break everything in the kitchen or like break something in the kitchen because someone didn't do the dishes, right? Which is a very common thing, believe it or not, right? And you're looking for the anxiety, the depression, like those kinds of things. Bipolar less common, and psychosis even more rare than that, but you can also experience perinatal psychosis as well. And once again, for that, you would be looking if there's a family history, if there's a family history of schizophrenia, if there's been trauma as well, because psychosis is a way to cope very often with trauma. So if you start to hear someone that's really not there, maybe someone that's deceased or crossed over, all right, that may be a problem.
Sorry, Tamara said it so well, like there's hardly anything to add. But just to reinforce that, with anxiety, it's just the excessive worry, which almost sometimes naturally comes with the territory for many women, like just worrying about becoming a mom, all the things that they need to do and have to become, and making sure they get it right, especially first-time mom, the sometimes obsession with, getting things in a certain way, a certain pattern, having the feeding, trying to understand the baby, trying to regulate your partner's needs, having to think about being stuck in the house or even going out of the house. Isolation becomes a thing, which connects with the depression. So there's anxiety and depression, they love to twin themselves. They're best friends. They travel together, right? So it is the worry about getting out there, worry about doing this, worry about going back to work. And everything is happening even pretty soon because they are interconnected, the worry and the depression. Also, just to add to what Tamara was saying, sometimes the others that are not necessarily anxiety, but they're closely related, would be like the obsessive compulsive disorder, the compulsiveness with making sure my baby's not going to die, am I doing the right things, etc., and redoing things. And also, especially if there's any trauma prior, the post-traumatic stress disorders just seem to just come up at this point, and connecting with all the emotional changes, because it's not just the mental health issues that are happening here. It's remembering that the hormones, progesterone and estrogen, that increased significantly when you were pregnant, now decrease significantly right after pregnancy. So your body just has this quick drop, which leads to, all these emotions, feelings, thoughts, etc., that are impacting now you transitioning into motherhood in that way.
I want to add just one thing. Tashika had, she touched on it a little bit. So one of the things that's most significant with Black women is that we are the only group that we are, according to the research, Pew Research Center, right? We are the only ethnic group where we are predominantly either we're the sole breadwinner or the primary breadwinner. And I find that to be really interesting because we also have the highest rate of maternal mortality, right? So when we're like worrying, it's not that we're worrying for no reason. And it's important to really kind of put that on the table and validate that, right? Because you're talking about financial stressors, which are huge, right? And also, Black women are dying at 3.5 times more than white women, like as related to pregnancy, right? So that stress piece is huge because you're trying to get back to work and add to the income of the family. And, you know, that's just a lot. It's just a lot.
Thank you for adding that, Tamara and Tashika. The information that you provide and the context of which we have different personality disorders and moods, it can be a lot, can be overwhelming. So one of the things I would like to know is if you have a mother who, you guys got these questions and it says, the person says they really feel like a terrible mom. They just don't feel bonded to their baby at all. If they don't think that this baby blues, they're not sure what it is. They don't know what to do. Like you both have indicated that these things can happen a short period of time, a long period of time, but this person just really doesn't feel bonded. And I know for a fact my mom had that experience with my sister. So this is very, it's kind of like a personal thing for me to understand. So what should that woman do? What should that mother do? You're muted. Tamara, you're muted.
Okay, sorry about that. So one of the things I would say is, and it sounds small, I would say follow the joy, right? Follow the joy, because that's very common with a lot of mothers, and you're really speaking in your own way about attachment, right? And when we have kind of breaks in attachment, we want to pay attention to that, because down the road, that child will start to experience their own executive functioning kind of impediments because of the lack of attachment with mom. And so where you start on that is at the very first breath. You want to try to get that baby to your body and have skin to skin contact, like the very first thing you do, right, in the room. And as your milk sets in, you want to try to have as much skin to skin contact as possible. You want to play with your baby. You want to speak in motherese to your baby. You want to have fun with that baby. So there are a lot of dirty diapers. There are a lot of there's a lot of feeding and bottles and this and that and overwhelming, but you definitely want to follow the joy, because the joy is where you're going to increase the bonding with your child.
Awesome. I'll just add to that, Tamara, to say, self-care is so important, and that's often overlooked, because sometimes in adding to the joy, which is very good and beautiful, sometimes even faking it until you make it, because it's not easy based on how you're feeling. That self-care component is going to be so important. Being very deliberate about getting rest. I know it's hard, but maybe taking turns with your partner, if a partner is involved, to say, okay, just let me get 2 hours between this time and this time. And then, I'll be up more in the night since I have to be nursing throughout the night, etc. Being able to talk to someone, someone about how you're feeling, being open and honest about how you're feeling so you can get that support, someone that you trust. And stepping outside, sometimes just stepping outside for sunshine, right? The natural vitamin D. And I know not all of us have babies in the springtime, summertime, but having that therapy light at home, or just making sure your vitamin Ds are up, etc. Taking care of yourself, because you cannot pour from an empty cup. There's no way you can give in to your baby if you are feeling empty emotionally. Small things that seem simple, like just showers, because sometimes you don't even get to shower because you're so into feeding processes, etc., and the anxiety of leaving your baby alone. So these, just to shower, the hydrotherapy will help your body to feel good, help, your mind, because often, because you're home, you're locked in weeks on end, you don't care how you look, you're just focused on the baby, and that, puts a damper on when you look in the mirror. It increases the depression if you're feeling it, and make you feel out of sync. So definitely the joy is amazing, and the joy is critical for that baby bonding. And then you, for yourself, what you need to do so that you can increase that joy, so that the connection with your baby will be even greater and more natural.
Sorry, I stayed muted. Thank you for that response. Tashika, while I have you here, you can take this, and then Tamara, you can chime in with additional information if you have it. Well, I know you have it, but we've all dealt with, and I had my daughter at the beginning of the COVID pandemic. So, have you seen an increase of postpartum depression for mothers during COVID?
Personally, I cannot personally, speak to that. However, I know that there were a spike and increase in the statistics regarding anxiety and depression over the COVID period. So you can automatically say, yes, there was an increase during that period because there were a lot of fears around COVID, especially the fear of, okay, even your child needing medical assistance and you're like, I don't want to go to the hospital. There's so many deaths there, everything that's happening. So I could definitely say like, yes, there would have been an increase in postpartum depression around that time because of the nature of what was happening and just a general increase in anxiety and depression as a whole.
So nothing to add, actually, that completely just encompassed what, and I said earlier in the week that we are on the edge of like a mental health cliff, and I'm very grateful that you guys are having the forum because things that were kept hidden for so long are now coming to the surface. And in the same way that babies are amplifiers, I do think that a worldwide pandemic is also an amplifier. So anything that was shaky prior to, it's going to come to the surface and you're going to see it. I would assume also that because of the increased isolation, that you are going to see more depression and anxiety, period. It may not be diagnosed as postpartum.
Okay, and I'll pose this question to you, and Tashika, you can add in. Have you seen postpartum depression occur more for mothers who have had delivery via cesarean section? Have they because the healing process is, I don't say a little different, it's a lot different for those mothers, and how exactly is that recognized or even just addressed for those mothers, because it's a different process for them?
So I don't think that the statistics show that there is a difference in postpartum depression. I would say a lot of that has to do with the self-talk of the individual undergoing the experience. So if you have a mom with really healthy self-talk, right, and they had a cesarean section versus a vaginal delivery, they're going to be like, oh my gosh, this is awesome, because that way it's all cleared out and I don't have to sit there and kind of like, hemorrhage for like weeks. Or they might be like, oh my goodness, I'm just so happy my baby's here and they made it safely, right? So it depends on the self-talk of the mother in question.
Similarly to Tamara, I would not say I saw any statistics on that. However, there's sometimes where physical pain can complicate just how you feel emotionally. And often when people do C-section, just the aftercare, it takes so much more than like sometimes a mom who did natural delivery and just having to be nursing the wound, taking care of the baby, sometimes not being able to do a lot of things, because you have some moms who are, I'm a go-getter, I want to get this for myself, and they have to be sitting down, not getting all the help they need. That can, make them feel even more depressed and stressed, having to deal with that and the fear of the wound reopening and having to treat with the baby and the baby's needs and not being able to be as active as they want to be. That can cause moms who do C-section a little more distressed than others. Not to say that it is always the case. As Tamara said, how your perspective, at the end of the day, your perspective is just so important, because we're mindful too that women who do natural delivery are also susceptible to lacerations and, all of that. So they have to go through certain processes too. So just being mindful that, it really depends on perspective and our way of thinking.
All right, and I'm gonna lead over to Rosita. She is monitoring our chat with the participants here. So I'm gonna lead off to you and you can ask those wonderful questions that are popping up and that will continue to pop up in the chat.
Yes, we have two so far. So the first question, how do you distinguish between whether a mom is experiencing postpartum depression or with other major postpartum stressors such as abuse, financial or poverty issues, etc.? How do you tell the difference between the two?
I'm almost sure that they would use, just as Tamara mentioned, in the hospital where they have the rubric to tick off whether it's postpartum depression or the baby blues, based on the symptoms that they are presenting with. Usually, especially if you feel as if you're having postpartum depression based on your symptoms and you see your psychiatrist for medication, or, they would definitely go through an assessment with you to see how long are some of these symptoms persistent, what are the symptoms you're having, etc. And then they'll be able to differentiate between, hey, this is postpartum depression, or this is maybe post-traumatic stress disorder, or other stresses that you're experiencing, and definitely differentiate for you whether it's baby blues versus postpartum depression / anxiety, or, some other mental health illness that you may have been treating with for a longer period than even before you were pregnant, but it's coming to the fore now because of the high level of stresses you're experiencing post-pregnancy.
So I agree 100%. I think one of the things to look at is, there's a lot of subtlety in mental health and psychiatry, and so that's why they give the tool. So the tool that they give is the EPDS tool that your healthcare provider will give to you. And one of the great things about assessments is if you give it at like 6 weeks, postpartum versus 3 months after delivery, right? You're going to see a distinct difference. If you see that after treatment or addressing some of the issues such as the financial issues or abuse, right? If you're able to kind of start to whittle those things down, if the answers stay the same, then you're really looking at something that is not postpartum, and you're really looking at a mood disorder or something else. And there's a lot of complexity to it. And keep in mind, your diagnoses can change over a period of time. So it may start out as postpartum, but it really may end up as an adjustment disorder, or it may end up as full-blown depression.
Great, thank you. Next question. In your experience with clients, are there hidden or unnoticeable symptoms that may lead to chronic illness?
So one of the things to be aware of is, I said it earlier, the stress, right? So one of the factors that lead to eclampsia and preeclampsia it's your high blood pressure, right? And so all these things are directly related to your heart. So you're looking at your biological markers, your blood sugar, your blood pressure, your inflammatory markers. Those are good ways to kind of see if you're at risk.
All right, and the next question, what barriers may prevent women from getting help for postpartum? Oops, I'm sorry, a couple questions came in and it made the chat jump on me. What barriers may prevent women from getting help for postpartum depression?
My gosh, there's so many barriers. And sometimes the very first one is denial. Like, some women do not accept that I have postpartum depression. They're sad and they're having these symptoms, but this will go away. This is not happening, etc. So denial can be very like one of the factors. We have to be real that a lot of women may not have the kind of insurance to seek therapy, and they want to go out for this, they want to get help, but they don't have kind of insurance policies. So finances can be a barrier as well. Also, just a lot of time people who suffer from depression, postpartum depression, they do not have the motivation to seek help. And often, sometimes they need someone to actually hold their hand for them to get help or take them to get help, because they're always withdrawing. They don't need this help, but they know what they're feeling, they know how they feel, but they're not motivated to go and seek help. And I'll leave Tamara to pick up on some if she wishes to share.
So one of the barriers, the biggest one that I'd like to kind of like bring up top is the stigma, right? So I was talking with someone about this yesterday. We were talking about it for a couple of days, and you know, they were very grateful that we were having the talk, because they said that when they had a child and they had postpartum depression, they were told to tough it out. Their mother-in-law was like, please, everybody goes through this, just tough it out. And meanwhile, she was spiraling into full-blown depressive disorder. And it took a very long time to crawl out of that. And one of the things she said was, I wish someone would have told me, right? I wish someone would have said, instead of, you know, tough it out, like especially for, you know, Black women, it's like, you know, we're tough, right? We're strong, like we're, you know, and it's like, well, we are strong. We're also quite vulnerable. And the difference is that we've come to terms with having to propel ourselves and take care of ourselves. But it doesn't mean that we're not vulnerable. That vulnerability may be hidden. And a lot of times when you see defensiveness, nastiness, like reactivity, that really is vulnerability trying to come out, but it's just not able to. So the biggest thing is really the stigma and finding your safe people, because everybody is not a support, right? And you cannot, it's really important to differentiate between your safe supports and random social supports. Right? You really want to be very clear, because in this time, you're going to be very vulnerable, and you want to seek your one or two safe people. It could be a healthcare provider. It could be like a spouse, a parent, something like that, to be able to say, okay, babe, come, let's go to the doctor. Let's figure this out.
Right.
I wanted to quickly add to what you said, Tamara, regarding stigma seeking help, but there's also some amount of stigma regarding medication and mental health too. And we have to be real with that. You know, I don't want to be diagnosed and getting a diagnosis, right? Diagnosis, like just getting a diagnosis, having to take medication, etc. The fear of also just, I'm a new mom, I'm breastfeeding, but knowing that whatever medication that your provider is going to put you on, or psychiatrist, it's going to be safe for breastfeeding, or they'll tell you how, or the dosage will be lower because you're breastfeeding. So, you know, that's something that gets in the way sometimes too.
Okay, thank you, ladies. We will return to questions in the chat, but for now, I'm going to turn it back over to Bianca.
All right, at this time, we are going to bring in our third panelist, Miss Andrea, who's coming on to talk about some of her experiences with her own areas of postpartum depression. And I'm going to pose the first question to you. And if you don't mind, can you share your experience with postpartum depression?
Yeah, sure. Hi, everyone. My son was born in January 2018. And it was around that time that I'd say that my symptoms began near the end of my pregnancy. But they were definitely amplified and kind of became more apparent once my son was born. Some of the symptoms that I experienced, heightened anxiety, like I've always been an anxious person, but it's never been to the extent where I felt like it impacted my life. And I had myself basically questioning everything I was doing, like, when I was pregnant, I feel this, is this normal? Is this how I should be feeling? Or once I had my son, how many times should I be feeding him? I had a C-section also. So I'm like, well, how should I take care of myself while I'm recovering to make sure I'm getting the nutrition that I need and the physical support I need, and then giving him what he needs as well. And also, I think my C-section was an emergency C-section. So I think that added some sort of trauma to the whole experience of becoming a mother. The whole thing was a blur. I didn't really get to see the baby until like an hour after the fact. So it was really a difficult time, just because I didn't know what to expect, and then having everything turned on me, I think made the really triggered more of the emotions and the symptoms that I developed. And I think the biggest thing for me was, I did talk to my OBGYN like a couple of weeks after I had my son. I kind of expressed some concerns, telling her, I am like kind of like obsessively Googling things to make sure things, are how the way they should be. I didn't feel necessarily super bonded with my son. Like you hear it described as all like rainbows and like happiness and everything. And that was just not how I felt. And I guess that also feeds into kind of the stigma that was touched on before too, right? Like, oh, I don't feel the way that I'm told I'm supposed to feel. What's wrong with me as a mother? Is there something that I did wrong? Or is there something, what do I need to do to, feel this way? So I think that was definitely a big part of my experience. And at the time, since it was so early, my doctor was like, well, maybe you have just the baby blues, or maybe something else is going on. She's like, but she did recommend talking to a therapist. So I did start there. But then as time went on, I've developed some other symptoms, like different intrusive thoughts regarding like harming myself or my child or someone else. And just, basically weakness was mentioned before. So crying all the time, pretty much didn't recognize myself when I looked in the mirror. Had problems sleeping, that sort of thing. I mean, I have more. I didn't know what the other questions are. So
No, we have one other. You touched on a lot, Andrea, and thank you for sharing, for being that transparent, because that's very courageous of you to share your story. And some of the things that you said, I wanted to ask you, when did you recognize? I think you said something a little bit early, like towards the end of your pregnancy, you had a sense that there was something. So if you can just go into a little bit more detail about that, like when did you recognize it was a problem?
So I went on maternity leave like a month before my due date. And I think at the time I was home alone for a lot of the period of time. I wasn't really that busy except for like getting things ready for the baby, and doing things around the house. And I think when I had time to just sit and be by myself, I think what ended up happening was I got inside of my head a lot. I wasn't distracted by anything else. And so, every little thing physically that I felt, I was like worried. I was like, oh, well, what if my husband isn't here when I, have the baby, or what if something else happens where like I need him here, but no one's, able to take me to the hospital or something like that. So I definitely think that last month was the most difficult for me. And that's when also like some of the just like negative thoughts would pop into my head. It wasn't as regular as it became after I had my son, but it started to have thoughts that were not in line with how I was feeling. And that was kind of scary because I'd never experienced that before.
We do have a question in the chat, Andrea, for you. They wanted to know, did your family notice?
Well, I think my husband definitely noticed the most just because he was around all the time. I think that my other family members could tell that I was not kind of like the normal, as joyful person as I typically am. Like if I'd laugh, it wasn't like a full-on laugh, like it was guarded, or like I didn't have the greatness of expression like in my face or something like that I would normally have. I am very lucky that my family has always been very open about mental health. My mom experienced postpartum as well. So I was able to kind of like address them once I got to be concerned possibly about it, that they were able to assist me when I needed it.
And the things that the two therapists spoke about earlier, would you say that that was pretty consistent with what your experience was?
Definitely. They both touched on a lot of things that I experienced, like the sleep disturbances, the the moodiness, weepiness. Basically, like I physically felt exhausted. I mentally was exhausted. I tried to do what everyone says, like go outside or make sure you're taking care of yourself for self-care and have people over and stuff like that. And I think when I realized it was an issue was when those things were not helping. Like I tried to do everything that I was told that I could do or should do. But I realized I needed more help than just that at that point. So that would probably be around my like 8 or 9 week checkup with my OBGYN is when I decided I needed to seek further help.
All right. And you say that you sought out your OBGYN and she provided or suggested that you seek out additional therapy for this. What supports did you find and how did you go about, seeking them out? Or once you got to one, did they refer you to others, or how did that?
So my first therapist that I found when I was looking at the time, there were not a lot of therapists in my area with openings that took my insurance. So that was kind of a difficult thing to go through. Also, I didn't really have any experience with mental health issues before. Like I said, I had some anxiety here and there, like family members had dealt with it, but I personally had never sought treatment for it. So it was a whole new thing for me. And like I did find a therapist, but like with finding a therapist, it can be very hit or miss. You want to be able to feel a sort of connection with them. And you want to be able to feel like you can be open with them. And my first therapist, unfortunately, she was fine. She just did not provide, I think, what I needed at that time. So at that point, I did go to my primary care doctor. He did put me on a low dose of an antidepressant. But then when I went back to my OBGYN at I think it was my 9 week, post checkup, I told her what was going on and she recommended I go to the ER for further evaluation for crisis. So that's what I ended up doing at that point. And then, I did end up going inpatient for a couple of weeks. When they usually the emergency room where you go, they'll be able to contact local hospitals that take your insurance to see if there's a bed available. If that's something that you're able to do. I was very fortunate that there was a place nearby where I live that was available. And then after my time there, I actually did go to Princeton House for the intensive outpatient and partial hospitalization programs that they offer for their women's emotional regulation. That's where I ended up after my inpatient.
Wow. Thank you for sharing that, Andrea. That is wow. That's I think it's kind of like a two-part question I have for you. One is when you started to experience that and you did spend some time in Princeton House, how did you feel being away from your baby? And the next part of that is, when did you begin to feel better or feel more like yourself? When did you begin to feel more like yourself?
So when I was away, I was inpatient for 2 weeks. So I only saw my son once during that time, because unfortunately they don't typically allow children to come and visit. They did make an exception for my son just because of his age. And I felt like I was losing out on time to be able to bond with him. I thought that he wouldn't know who I was, but I was very lucky that the nurses and people I worked with, they reminded me, they're like, you need to take care of you. Like somebody mentioned earlier, like you can't pour from an empty cup. Like if you're not taking care of yourself, if you're not getting what you need, you're not going to be able to be there for him. So like take care of you first, make sure you are, solid, make sure you feel, more like yourself so that you're able to be that mother to him. And I think when I really started to feel better, was more probably around the end of my time in Princeton House. So that probably was when he was like 7 or 8 months old, maybe something like that. Because I did a couple, like I said, a couple programs with Princeton House, and then did do some continuing therapy after that. But I mean, I still am personally currently dealing with symptoms of OCD. That's something I'm seeking treatment for. I think that is also part of what I had kind of started postpartum, but has kind of continued and past that time now that my son's 5 years old. So but I think also the proper diagnosis, can make a difference too, postpartum and, otherwise.
Well, Andrea, thank you so much
Yeah. No
for
problem.
your complete transparency, your honesty. I'm here with you.
I feel it's so important because a lot of people, there is shame to it. People think, if I feel this way, I'm not a good mother, but that's not the case. And I really just want to make sure there's awareness out there. If someone's going through it, to know that they're not alone.
No, we appreciate it, deeply appreciate it, because these are conversations that need to happen and that need to continue to happen. This is not something like, oh, we just spoke about this tonight, we're not going to worry about this again. No, because it not only affects you as the mother, it affects the child, it affects the entire family dynamic. So from my heart to yours, I appreciate you completely. At this time, right now, we're going to turn it back to our two panelists, Tamara and Tashika, to see if there were any other words or feedback that you would like to provide to us on this topic for this evening.
So I'll just go first. So one of the things that there were a couple things in the chat that we didn't get to, and I just wanted to touch base on them. One is nutritional remedies or kind of exercises, et cetera, et cetera. So no, there are you want your vitamin D, as Tashika said earlier, you want your omega-3 fatty acids for your brain and to lubricate that myelin sheath to make sure that, you're doing what you need to do. You want to make sure you're getting enough calories to sustain your body. But I don't think there is a nutritional remedy per se, because there is no, and I'm a very crunchy person, right? But there is no nutritional remedy for depression, right? I really, Andrea, thank you so much, because depression can spiral very quickly and it needs to be addressed medically. One of the things that the research shows is that Black women tend to go to their spiritual advisors instead of to medical professionals, and that really impedes progress. One of the things with mental health that's very frustrating is it takes so long to recover. And you're talking about months, if not years, right? And, the longer you wait and delay treatment, it's going to get exponentially worse, because your self-talk is going to get worse and you're just going to spiral downwards. So that's one. The second thing is, what exercise routines do you recommend? So I want to say yoga, I want to say all those things because I love all those things, yoga, Zumba, all of it. But actually, I would just say whatever you find fulfilling for your soul. Right. So if your exercise routine is to take your dog for a walk and that really fills your soul and it restores, refreshes, and renews you, that's what you need to be doing. Do you need to be doing high intensity impact or, on the Peloton? No, not so much. Just a thought.
Thank you, Tamara. And there's not much to echo after you said that, right? But just to further enhance the nutrition, yes. You see, your food is important. It's very important in how you eat at this time, to be honest with you, because a lot of times we like to snack on quote unquote junk, right? But you want to get solid meals in because you're breastfeeding. And you will learn coming from the hospital that, hey, the first few months, you really want to up your liquids. The soups, the shakes, etc., because that will help with, milk production, and that makes it easier for you and baby. So just making sure that your food has in, as Tamara spoke about, the vitamins and the B vitamins, and selenium is great from the Brazil nuts. it is nice to just go and research foods, fruits, vegetables, the different nuts and their health benefits. You'll be like totally surprised at how food with antioxidants like blueberries are great for depression because they boost your moods, and bananas and stuff. So imagine just popping in a shake with bananas and a few nuts that you like, pistachio, etc. Blending that up, and that's a nice meal to start your day. It's liquid. It will help with milk production, and it will help to boost your mood. So just spend some time looking at some things. If you feel like you need that extra support, it will not hurt to see a nutritionist during this time to help to guide you along the process and to make the process easier. That's definitely something. And Tamara already touched on exercise, so I'm just going to quickly touch on support system, right? There are a lot of Facebook groups for moms. You really can get support there. You can get, and sometimes if you just look in your community where you're living, there are different mom support groups where moms are at home, and some of them who are even not at home, they literally link up in the afternoons with their babies and they go for little walks and, go around the community. And that can be so helpful for you because you're not going far and you're with people who are experiencing similar things that you're experiencing, and you can share ideas and talk about stuff, and you feel like, oh my gosh, this is amazing. I'm not the only one going through this. And it opens your perspective, give you something to look forward to because, you have planned dates where you're playing together with babies, etc. And that can enhance and encourage your relationship and reduce isolation, and thus helping you to feel better about yourself and reduce depression if it's present.
Okay, Andrea, was there anything else you wanted to add or add to the discussion?
I don't think there's really a lot for me to add. I just think that it is important to kind of recognize that there is a spectrum of the postpartum disorders that they've touched on, both therapists have touched on. I think that depression is the most common, the most talked about. But from my personal experience, yes, I did experience the depressive part, anxiety, but I also had symptoms of OCD. So I think that just educating yourself, or hopefully medical professionals can educate themselves too on the different things, just kind of being a more open discussion about all of the possible ways that these may manifest in a new mother. That's really all I want to add.
Great, thank you so much. And thank you also to our other two panelists, Tamara and Tashika. The insight that you have provided us with this evening is far beyond, this 60, 70 minutes was not enough because we probably could be on here until 2025 speaking about the variances within postpartum depression and the importance of taking care of oneself. So we thank you all for agreeing to join us and to not only share the information, but to share your personal experiences along with here with us tonight. We are close to wrapping up, but there were some things that we wanted to touch upon this evening. We wanted to share with you some links and resources here for you all to use. If it's not for you, it's for someone close to you, you can share this information with. These are just some of the resources that are available from our two panelists here as well, and also some national information on postpartum here for Postpartum Support International. And one of the keys that Tamara actually shared with us the other night was to actually contact your OBGYN and primary care physician, because they are able to first pinpoint what is going on and possibly, if needed, provide you with that medical resources of providing medication and also getting you out to different resources to help address those issues that you have that are occurring with you. We also want to recognize NAMI. NAMI was actually one of the resources that Andrea used during her, well, not during, one of the resources that she continuously uses throughout her journey. So the information for NAMI is here, which is the National Alliance on Mental Illness. They're one of the largest grassroots mental health organization dedicated to bettering the lives of millions of Americans affected by mental illness. So yes, they do address postpartum depression, but they're also able to help you address other issues within the mental illness dynamics. We also want to recognize that there is, within the city of Trenton, we have a breakdown of maternal health readiness. We do not have any birthing centers here within the city of Trenton. All of our centers are either one in Hopewell Township or in Plainsboro Township, or borough rather. So with that, the city has recognized this, and they are in collaboration of one seeking a grant. Well, actually, they've been awarded a grant to actually build a birthing center here within the city of Trenton that will help address the maternal needs for mothers. We are in talks with some of the grantees and getting that information out. So as more information becomes available, we'll be holding our next speaker series within the month of May to talk about that particular area of maternal health that will address not only the birthing center that will be built, but also some possible legislation to address the maternal health needs and postpartum depression here for mothers within the city of Trenton and the state of New Jersey. At this time, I am going to send it over to our esteemed presidents here on the panel for our two organizations here. I'm going to turn it over to Crystal Miller, who is the president of the Epsilon Zeta chapter, here within the city of Trenton. And following would be the president from our chapter, the Trenton Alumni chapter of Delta Sigma Theta, with their thank yous.
Good evening, everyone. And I want to say first, welcome and thank you for joining us. This is often a subject that is not talked about and doesn't get a lot of attention. So I want to thank our committee, our Z-Hope committee, which is Zetas Helping Other People Excel, our mental health branch, for partnering with the ladies of Delta Sigma Theta Incorporated and bringing this much needed panel discussion to you. This is something that we've done in the past, and I am glad that we are partnering with them again. This was one of the benchmarks of my presidency, where I wanted us to partner with other D9 organizations, sororities especially, in our community endeavors, giving back to the Trenton community. So I want to just mention a couple of upcoming events that we have. First and foremost, it is scholarship season for us. So you see the flyer here where we are offering scholarships to eligible Trenton High School students who are in their senior year. And one of the unique things about our scholarships is that we award monies to males and females. So if you know someone who is graduating from high school and needs a little bit of assistance, a little push, a little boost in terms of pursuing their college degree, please have them to apply for our scholarship. There are very few students who apply who do not get awarded monies from us. So please help them encourage them to apply, and you will see our website on the bottom of the first flyer. The second thing that I would like to mention is that our youth organization, Zeta, was the first historically Black sorority to have youth auxiliaries, where we mentor young ladies from the age of 4 all the way through high school. They are having a fundraiser. So, you know, one thing that we all do, we all love to eat. So if you are out on a Sunday and you are hungry and you would like to join us from noon to 4 p.m. in Texas Roadhouse in Hamilton, we welcome you. And a portion, if you give our code, a portion of the proceeds from your meal will then go to support our youth auxiliaries in their endeavors. I would also like to mention that Zeta also has a Stork's Nest, and our Stork's Nest program is in conjunction with the March of Dimes, where we do maternal health and education. And anyone who participates in the Stork's Nest program, those ladies walk away with formula, diapers, and clothes to help them get through the first couple of months of being a new mom. So again, if you go to our website, you can learn more about the Stork's Nest program there. And again, if you know someone who is in need of assistance, please, again, encourage them to go to our website and sign up for our Stork's Nest program. One, we don't turn anyone away, and two, we make sure that all moms who participate in our Stork's Nest program get supported, in months 1 through 3 of being a new mom. The final thing I want to say, as a mental health professional as well, one of the resources that we did not talk about is 988. Which is Monumental, which is a new crisis and crisis and mental health hotline, which was established by SAMHSA, which is through the United States federal government, where the suicide and crisis hotline went from being a long 1-800 number to just simply 988. So if you know someone who needs help, who is in a mental health crisis, and they don't have to be in a mental health crisis, but just need support or just need someone to talk to, they can dial 988 and get the assistance that they need. Thank you.
Good evening. On behalf of the members of Trenton Alumni Chapter of Delta Sigma Theta Sorority Incorporated, I thank our attendees for joining this evening with our speaker series on mental health, Healing from the Inside Out, a look at postpartum depression. To our panelists, Andrea, Tamara, and Takesha, thank you so much for sharing your expertise, your knowledge, and your experiences with us. We greatly appreciate your knowledge and your experience that you shared with us this evening. To our chapters, Information and Communications Committee, thank you all for your technological support. And to our Greek sisters, a part of the Divine Nine, the ladies of Zeta Phi Beta Sorority Incorporated, Epsilon Xi Zeta Chapter, and the Z Hope Mental Health Committee, we thank you for partnering with the Trenton Alumni Chapter Health and Wellness Committee, as well as I thank the chairs, Linda Wyatt Simpson, Chair, Bianca Taylor Davis, the co-chair, and the committee members. As you know, the African proverb states, if you want to go fast, go alone. If you want to go far, go together. And so this evening, we are trying to go as far as we can with reaching our communities with this particular information on mental health. So I would like to thank you all again for attending this evening. Please complete the evaluation when you have the opportunity. And as far as Delta Sigma Theta Sorority's upcoming events, we have a casino, Crimson Casino Night, which is this Friday. And we greatly appreciate the support as the proceeds benefit our scholarship fund. We also currently are having a diaper drive in which we are donating wipes and diapers, and we're able to take your collection, and please reach out to any member of the Trenton Alumni Chapter. All donations will be handed to residents within the city of Trenton. We also have our 5K Sisters Walk, our 5th 5K Sisters Walk, which is Saturday, May 13th at 9 a.m. And at Cadwalder Park, if you can come out and support, that would be great. We have quite a few other items out there as well, but these are the current things here. And so we ask that you provide support to both organizations. Again, I would like to thank you, and I'll turn it back over to our chair.
So sorors and friends and ladies of Zeta Phi Beta, we thank you so much for this evening. We have always tried to work with others and do what we need to do for the community, but your expertise and experience tonight has enlightened us and has inspired us to continue the work that we're doing. So again, we thank you, we thank you, we thank you, and we hope that everyone has enjoyed this evening and has gotten some information out of it, if not for yourselves, for someone else, that you can pass it along, that maternal health is so important for our community, no matter who you are. It affects women so greatly, but it affects families even more. So we have to keep the push going and make sure that we get the word out that maternal health is important. So again, thank you, thank you, thank you, and please have a wonderful evening.